Following the escalating threat of the Ebola outbreak in the continent, the government has today made a decision to defend its borders and ordered drastic measures that take effect within the next 2 days. Passengers traveling from or through the affected region in West Africa will no longer be welcome to land on Kenyan soil as a measure to ensure that the disease does not find itself in the country. This comes barely hours after 5 persons were tested at Kenyatta National Hospital on suspicion of having Ebola symptoms. Health Cabinet Secretary James Macharia, in a late evening conference, revealed the decision was arrived at following the need to contain the Ebola virus from spreading outside West Africa to other parts of the continent.
In the interest of public health, the Government of Kenya has therefore decided to temporarily suspend entry into Kenya of passengers traveling from and through the 3 West African countries affected by Ebola, namely Sierra Leone, Guinea, and Liberia, effective midnight, Tuesday, 19th August 2014. This suspension applies to all Kenyan ports of entry. The suspension will exclude health professionals supporting efforts to contain the outbreak and Kenyan citizens returning home from those 3 countries.
At the same time, incoming Kenya Airways CEO Mbuvi Ngenze announced that the national carrier has suspended direct commercial flights to the most affected regions, namely Guinea, Sierra Leone and Liberia, urging passengers who had made earlier bookings to liaise with the airline for the way forward.
Kenya Airways wishes to confirm that we will comply with the advice to suspend our commercial flight operations to Liberia and Sierra Leone temporarily. This operational decision, effective Tuesday, 19th August 2014 midnight, is based on the situational risk assessment by Kenya's Ministry of Health. We wish to express our sincere regret for disrupting your travel plans. We further wish to confirm that we shall be providing for full refund of all tickets earlier booked and paid for prior to this suspension.
WHO and MSF, that is Doctors Without Borders, have termed the situation as underestimated and fear that the outbreak may take up to 6 months to contain. New figures released by the UN Health Agency show that the death toll is up to 1,145 in the 4 afflicted West African countries, that is Guinea, Liberia, Nigeria and Sierra Leone, as the use of experimental drugs is authorized. WHO classified Kenya as a country under high risk from the Ebola outbreak given its strategic point in the continent. Victor Muyakhane, Channel 1.